So as a urogynecologist, we don't do obstetrics. We don't deliver babies, we don't handle pregnancies, except in a certain rare case where a woman recurrently has pregnancy loss due to a weak cervix. It's called recurrent pregnancy loss due to painless cervical dilatation. And the surgery that, as a urogynecologist, I helped to develop with my colleague is a robotically placed stitch to keep the cervix shut to prevent infectious agents from the vagina from contaminating the amniotic lining, to trigger the kinds of inflammatory response that can lead to premature delivery. That stitch is called a robotic cerclage. It's placed abdominally with the robot to go around the cervix in a very carefully crafted way. Before there's any hint of cervical dilatation or preterm labor, the cervix is closed, and that usually results in isolating the amniotic sac and the pregnancy fluids from the potential infectious agents in the vagina that could contaminate things. The robotic cerclage is a version of the stitch that saves, and when done appropriately, well before any kind of infectious process happens, it works extremely well. So it's one of those rare cases as a urogynecologist that I deal with pregnancies up to probably 18 weeks in a patient with premature cervical dilatation and recurrent pregnancy loss due to that. Usually goes along with a referral from a high-risk obstetrician or an OB/GYN doctor who's taking care of a pregnant patient, who will say, based on my evaluation as an OB/GYN, I recommend that you obtain an abdominal cerclage immediately pre or post-pregnancy or early in the pregnancy, long before any dilatation happens. And that patient will be referred to someone like myself who can place that stitch safely. We, as I mentioned, developed a technique using the surgical robot that very quickly and safely gets that stitch placed around the cervix in a place where it's adequate and appropriate for getting the job done, and they work extremely well.
Ways to place a cerclage, essentially you're placing a stitch around the cervix to try and prevent it from dilating prematurely. Many times, traditionally, the cerclage is placed through the vagina, and usually it's placed at a time when the cervix has already demonstrated that it's dilating. And you do what's called a rescue cerclage in an attempt to try and close the cervix down and prevent it from dilating. Many times that cerclage can work, many times it doesn't work. However, another approach to placing it involves placing the cerclage long before the pregnancy actually occurs to actually close the cervix off enough so that the mechanisms that help lead to the cervical dilatation, i.e. some of the inflammatory mechanisms, are minimized. And one way to get that cerclage in place to minimize the inflammatory mechanisms is to place a cerclage abdominally. And an abdominally placed cerclage is oftentimes placed when the patient is not pregnant or very early in the pregnancy, long before the cervical dilatation is beginning to occur. So the abdominal cerclage is designed to prevent the inflammatory conditions that can lead to premature creation of labor, leading to premature delivery.